following is an excerpt from a November 2018 lecture Dr. Amy Dayries gave as a webinar for the Academy of Integrative Health and Medicine. The excerpt involves how an integrative dentist can support a patient who might have sleep apnea, a history of a concussion, or who has developmental troubles.
And then the last thing I really wanted to talk about today is the dentist and the treatment of sleep apnea. And this has gotten to be a really passionate topic of mine because we have so many patients with undiagnosed sleep apnea. They say 85% of people that have sleep apnea don't even know that they have it. And what we see with sleep apnea is we'll see an increase in hypertension, insulin resistance, and obesity, neurohormonal changes, oxidative stress. Again, it's going to lower your nitric oxide. And remember, I mentioned at the beginning of our lecture that the back of the mouth is really the front of the brainstem. And when you have this hose, this is the airway on a cone beam x-ray. When this is pinched, the patient's going to have a very hard time breathing. And our traditional orthodontic appliances oftentimes will be retractive or orthodontics, where they may even pull some permanent teeth to be able to have a nice profile at the end. But when you retrude the maxilla, the mandible is retruded, and you can end up with a compromised airway. And some of the cone beams are color-coded. It's more of a measuring thing. The color code helps to identify for patients, I think, or educate patients where a crimped airway is, and that would be where you see the red and the orange. You want a nice big open water hose, so to speak, to be able to breathe easily. And when you have a crimped airway, you often will see correlations with TMJ problems, headaches, anxiety, ADHD and focus issues, vertigo, itchy ears, laryngitis, chronic sore throats, a whole host of many problems. You'll have limited jaw opening. A lot of times these patients are tongue-tied and they aren't able to swallow easily. And in our Gray's Anatomy book that we used in dental school, they always depicted the tongue down, but the tongue should be actually resting up inside the palate. And these days I send a lot of folks to myofunctional therapy because the tongue also helps form the palate. The modern jaw, oftentimes when you have a tongue down and you have a soft diet, the patient is not having their tongue support the palatal growth, and they end up with a narrower arch, more crowded teeth. And you'll often see with this crowding and narrower arch, a scalloped tongue, hypertension, obesity as time goes on, and also a forward neck posturing, that dowager's hump as they get older. Let's see, I'm just trying to find my toggle. Here we are. And again, a lot of times this starts with the tongue, that second muscle to get innervated after the heart. And when it's down, it's going to overstimulate that sympathetic nervous system a bit, because the parasympathetic nervous system is associated with slower heartbeat. So you want to increase or turn on your parasympathetic nervous system more. So we want to do things that are going to tone down that sympathetic nervous system. What we've also seen is patients that have had cranial nerve trauma, like concussions. They oftentimes go back to some of their primitive reflexes, and a lot of times they have to be retrained, and dentists can help with this too, or myofunctional therapists can help with this to get their tongue more properly positioned. So statistics on airway, 85% of oral sleep apnea is undiagnosed. And then these are just more common complaints. And so we're going to wind up here in a minute, but this is just reiterating some of what we said. There are some different devices out there on the market that can encourage, even for young children, this is the Myo Munchie out of Australia, a better development, a widening, a horizontal growth pattern instead of a vertical growth pattern. And, you know, the go-to, the gold standard for sleep apnea these days is the CPAP, but it has about a 30% compliance rate. And that's why in the dental world, you're seeing an insurgence of us making or trying to make devices that can support that patient. And what we have found is that we can actually sometimes grow the airway even in adults where we didn't think that we could before. And one of those is called the Oral DNA. It's by Vivos, and another one is called the ALF. And I was just going to point out, this is actually one of my daughters before myofunctional therapy, and about 4 months later, you've seen she's grown horizontally here, and her cheekbones have more support. And this is what an ALF can look like. So it's very minimal wire. It doesn't crank on the teeth. And a lot of times these kids have fewer focus issues and can sleep better. And a lot of this is the myofunctional therapy. The therapy teaches, there's 8 segments of the tongue, and it's strengthening all 8 segments. It's sort of like having a personal trainer. And again, as you have that tongue more relaxed, you increase your heart rate variability. This is another one of my daughters, and she's part of my why that I got into integrative medicine at all, because she was very, very narrow and small. She often had dark circles under her eyes and had a lot of focus issues at school. But she was very creative. And she used to say, Mom, why? She would ask me the most zaniest questions like, Mom, why did God make mosquitoes? And Mom, why can't my American Girl doll, why can't I let her lie down and look up at the stars? But she really had trouble focusing at school. And through myofunctional therapy and some of these other devices, she's actually gotten to be a national fiddle player. And I'm not going to play this video for you because I understand that you are not able to see it on this PowerPoint. But she got to play at Atlanta Irish Fest recently, and she's done really well.